Hi, good evening, everyone. Uh, I am Dr. Arnav Karmakar. A very good evening to all of you. So, kindly let me know whether I am audible clearly to you. So, I welcome you all in this ACE Neuro group because today we are going to discuss some very important issues, some very common issues which many people face in their day-to-day life. So, first of all, I introduce myself as an orthopedic surgeon, consultant orthopedic surgeon practicing in Calcutta, and mostly I am interested in sports injuries, arthroscopy, joint replacement surgeries, spine surgeries, other things. So I am an associate professor in IPG, MER, and SSKM hospital, and practicing in different hospital in Calcutta also. So today we have gathered here to talk and discuss few important topics, and we have named the event as the painful conditions of hand and elbow. Okay, so pain is the most common problem or the commonest symptoms the patients come to us as an orthopedic surgeon, and it is the most annoying feeling. If somebody is suffering from a chronic pain, it's the most annoying feeling any people can have. So we need to do to relieve the pain. So to start with, there are many diseases which can affect and which can cause pain in the elbow and in the hand. There are some local diseases because of the local issues in that area, in the elbow or in the hand, it can cause pain. There are some central issues that can cause pain in the hand. Those are called radiating pains. Suppose somebody has a problem in the cervical spine or their neck, the nerves which is coming from the cervical spine to the hand or in the upper extremity. So if some problem is there, if some bulged disc is there or some osteophytes is there which is actually impinging on the nerve, that can cause pain in the arm. So those are called radiating pains. But today we are not going to discuss all those radiating pains or the central problems. But today we are going to discuss all the local issues one person can suffer from in their painful hand and elbow. So we'll start from our hand issues and gradually we can go up to elbow. So very common issues that can happen in our hand is called trigger finger. So if you can understand from the term itself or the disease itself, it is called trigger finger. So what happens exactly in this disease that somebody's finger gets locked. Suppose a person is suffering from a trigger finger of the index finger, then what happens if he closes or flex, make a fist, then it gets locked and it's just don't open by its own. So either he or she may have to assist it, or it becomes painful, or it becomes not that smooth or easy to flex and extend that finger. It can affect any finger. Commonly, it affects in the thumb, that is called trigger thumb, or it can affect any of these fingers. So, what happens in this trigger finger? If you can understand this, the functions of our hands are very specific, and there are specific muscles and tendons for the all the functions, all the joints. So there are flexor group of muscles or tendons which actually flex the all these interphalangeal and metacarpophalangeal joints of the hand, and there are extensor group of tendons. So what happens, these tendons come above around the elbow up to these fingers. So these tendons throughout their way they can be trapped somewhere because they need to go or underpass different pulleys. So they can be trapped under some pulley, or that in that area this tendon can be locked. So this can happen because of injury. Yes, injury can cause a trigger finger or trigger thumb, but also there are other diseases which can result into a trigger finger or trigger thumb. Likewise, diabetes. Yes, that is a very common combinations of diseases, association of diseases, diabetes, hypothyroidism, hypercholesterol, then arthritic conditions like rheumatoid arthritis and other arthritis that can affect these tendons or irritate these tendons. The tendon may be thickened or the tunnels may be narrowed. That can lead to blocking of the tendons. So if you can understand, there are various issues which can happen or lead to a trigger finger. So in those cases, what happens? We need to understand that how it happens. If you can understand this image, you can see there are this tendons actually goes by different pulleys and that may be blockage in these areas. So here we need to release them to make it easier to make it cure. So the treatment basically to start with in the initial phases is conservative. We advise them to do exercises, to do contrast bath. We allow them to do pushing and pulling exercises with some balls, and we can give them some medications which can help to reduce the inflammation and pain to start with. But if there is any associated or underlying condition, then you need to treat that properly. Maybe it's a diabetes, maybe it's a arthritis. And in some advanced cases, when it is not resolving with the conservative management, then a local steroid injections may be an option in those cases which are resistant to conservative management. Like, and finally, a surgical option may be tried for multiple trigger fingers for patients who are not controlled properly for diabetes and for patients in whom steroid injection cannot be done. So for multiple trigger fingers or locked fingers, because in some cases, if the tendon is too thick or the channel is too narrow, then it can actually lock. It can lock the finger in that position. So in case of locked finger, surgical option, surgical release of the tendon can be an option. So this is the commonest thing for our hand. Next comes a very commonest and very problematic disorders, and the females are very commonly affected. It is called a carpal tunnel syndrome. So young females, yes, young females can be affected in these cases also. And carpal tunnel syndrome has been associated with a lot of diseases, most commonly being the hypothyroidism, rheumatoid arthritis, anything, any systemic disorders. The person may have a liver disease, the person may have cholesterol issues, the person may have bleeding disorders. This carpal tunnel syndrome has been associated with many systemic diseases. So what actually happens in this carpal tunnel syndrome? This carpal tunnel syndrome, actually what happens, if you can understand, so we have shown you that there are so many fingers, so many joints and so many tendons are there. So in this area, in the wrist area, so many structures are actually coming from the elbow and going to the wrist. And if there are so many structures, there are bands which actually keeps and stabilizes all these structures in place. Otherwise, it will be very disturbing. So the median nerve, which actually goes in the front, exactly near to this line, the median nerve is going and crossing the wrist. And there are wrist, some retinaculum, flexor retinaculum is there, which actually binds up all these structures together like a band. And there are some ligaments which actually bridges the small bones which are in our hand. So due to any of this, the tunnel which the carpal tunnel, that means the tunnel between the carpal bones can be narrowed. So whenever the tunnel is getting narrowed, there may be three issues. First of all, the tendons sheaths, the covering of the tendons may be broadened or they may be proliferated because of some other issues like rheumatoid arthritis, and there might be osteophytes, like because of the underlying arthritis there might be osteophytes, a new bone formation which can pushes and then narrows the carpal tunnel. So anything which narrows up the carpal tunnel actually compresses over the median nerve. So wherever there is a compression over the median nerve, the nerve supplies of this hand muscle, there will be numbness of this area. These three fingers in the palmar aspect, there will be numbness, there will be dizziness, and gradually there will be wasting of these muscles. This part is supplied by the medial nerve and this part is supplied by the ulnar nerve. So whenever medial nerve is compressed, then there will be wasting, or this hand, the thumb area will become flat gradually, and there will be weakness of the hand. There will be disturbing tingling and numbness in the hand, and the commonest complaint being, if you are trying to hold something for suppose 5-10 minutes, you are not able to hold it. Sometimes it feels that the things will fall down from your hand, and there is increased nighttime pain. So this is a indication of nighttime pain. Whenever you are sleeping, you got disturbing uneasiness on your hand and you need to get up. And sometimes the pain can radiate, go back up to the neck because there is a distribution along the median nerve. So, but to start with, it usually starts from your hand and it affects your hand and the palmar area. So, same treatment initially, you need to understand what are the underlying diseases. You need to cure all these diseases or you need to control all the diseases, because unless you control the underlying diseases, the main thing will not go. And even if you do the local therapies, the recurrence will be there if the underlying disease is there. So, regarding the treatment, at very initial stages, you need to first confirm the diagnosis. To confirm the diagnosis of carpal tunnel syndrome, you need to do a nerve conduction velocity test. So NCV test is very, very important. Whereas we discussed about trigger finger, the diagnosis is almost like a clinical diagnosis. Your doctor will do a clinical examination and they can say whether you are suffering from a trigger finger or not. But for carpal tunnel syndrome, it's a clinical diagnosis which has to be established by a nerve conduction velocity test. So NCV test will clearly say that yes, you are suffering from a carpal tunnel syndrome. Initially, when the symptoms are too less, to your just symptoms are starting, in those cases, you can give some splintage, some nighttime splintage, which allows the wrist in slight degree of flexion so that the space increases in neutral position and also allows some movement. So nighttime splintage can be done to give rest to the nerve, and mobilizing exercises, stretching exercises, alternate hot and cold therapy, and some local and physiotherapy like interference therapy, TENS therapy can be of helpful in initial phases. But a well-established carpal tunnel syndrome, which is proved by a nerve conduction velocity test, the treatment of choice would be a surgical. Yes, for carpal tunnel syndrome, it is not possible to cure the disease with only medication. Medication and physical therapy will give you some relief, but to cure the disease, the treatment is always surgical. Because if you can understand, this is a mechanical issue. This is not a physiological issue that the nerve conduction or the nerve is getting weakened. It's not like that. It's getting compressed by some structures. We need to open that up. So we do surgery. We just give a small incision here. We just find out the nerve, then we cut the flexor retinaculum and the intercarpal ligaments, which are actually compressing the carpal tunnel. So we opens up the carpal tunnel, the nerves get free, and the numbness and the uneasy feeling goes away. But again, if there has been already a wasting or weakness of the muscles, it's very difficult to come back or to recover that muscular weakness or wasting. So don't neglect carpal tunnel syndrome. If you have such problems or symptoms, do visit your doctor, get the NCV done and treat early, because if you treat early, it is 100% curable. But even at late stages, we have seen patients that all this part has become flattened, and even after surgery, the pain has gone up, the numbness has gone up, but the strength has not improved because of the already wasting of the muscles. And if the muscles is gone, it's very difficult to get it back, because here you cannot do weightlifting exercises like you can do for your biceps or quadriceps. So here these are very small muscles. These nerves are very small. So if the innervation is lost, then it is very difficult to recover. So always remember, for carpal tunnel syndrome, treatment of choice is surgery, surgery, and surgery. So we can move slightly upwards. Next comes is the most commonest problem. Everybody comes especially who are writing a lot, who are playing instruments, who are doing small mechanical jobs, they say and complain pain in the wrist area. So this is the area in the base of the thumb, exactly at the junction of the wrist joint. There has been a painful area. If you can palpate this area, if you feel there is a tendon and your thumb, you are moving just at the base of the thumb. So this is the problematic area. This disease is called de Quervain's disease or DQ disease. As I already discussed, this is very common in persons who are actually using their hands and thumbs lot of pressure. They push, give more and more thumb pressure and give do such activities. In that case, the mechanism is somewhat same like the trigger finger we discussed. Again, for the thumb abduction, two muscle tendons are responsible, which tendons are again anchored at the styloid of the wrist or radius bone at the angle of the wrist joint. If the tendons thicken or the tunnel becomes narrow, then it actually presses over the tendon and that causes inflammation and pain. So anything if you can do, you can extend the thumb or you can flex the thumb, it will cause pain here. It's very difficult to do any twisting job or very difficult to do anything with your thumb. So these are the symptoms of a de Quervain's disease. Again, all these tendinopathies, we call all this type of disease as tendinopathies because it involves the tendons, and somewhat the physiology or the problem of diseases are somewhat similar to each other. So again, the more thing is that repeated stress or repeated twisting activity or repeated activities can cause this type of pain. Again, it's common in players, it's common in mechanics, it's common in musical instruments who plays musical instruments. So guitars and all, so it's common in them. So repeated friction, it can be from an injury. Again, it can be because of some underlying diseases, and also, as we already discussed, like diabetes, like hypercholesterol, like hypothyroidism, like arthritis. Any form of arthritis can irritate the tendon and cause a de Quervain's disease. So again, treatment for early stages, yes, physical therapies, local alternate hot and cold. We give a wrist wrap band. We suggest them that you wear this wrist wrap band whenever you are working or using the thumb, and give some medications, anti-inflammatory medications, allow them to do the wrist stretching, different type of exercises are there, and we give some medications of some collagen which can help to healing of the tendon. But again, if it is not controlled by this conservative management, next step would be a local injection of steroid, and 2 or 3 doses of steroid injection may be necessary at a 7 to 10 days of interval. And the last stage or last option would be a surgical excision of this release of the tendons of the de Quervain's disease. So surgical release is the ultimate option. Surgery will give you a permanent cure, but steroid injection at an early stage in a controlled disease can give you also very good results. So uh, initial stages, always it's better advisable that if you are having such symptoms, please don't neglect these symptoms, because early intervention is the key to success. So de Quervain disease, I will show you up you one image to make you understand better, that if you can understand, this is the image of the thumb, you can understand this is the actually the tendon of the abduction for the thumb. Two tendons are there, and this is the band which is actually stabilizes the tendon. So here actually the pain happens and that irritates the tendon. So this is called a de Quervain's disease. Again, conservative management is beneficial for 80 to 90% of the patients. 10% of the patients may request local steroid injection, and very few of them may require a surgical intervention. So if we can go for early intervention, then we can avoid a surgical intervention. Next comes another painful condition around the wrist. So from the hand we have come to the wrist. It is called the ulnar TFCC pain or ulnar styloid pain, ulnar ligament sprain. So there is some, again, it happens because of injury, fall on outstretched hand. There is a twisting injury. Suppose somebody is carrying and trying to lift a very heavy weight. So in the forearm, there are two bones actually. One is this side radius and one is ulna. So this is the wrist joint motion, and also there is a joint in between these two bones, and there are some ligaments here in the ulnar styloid process. So whenever there is stretching on that ligament or injury on that ligament, that can cause pain here on the ulnar point. And again, if you are going and doing some twisting activity, are trying to push up your body over the wrist, it will cause pain here. So again, ulnar styloid pain can be because of injury, can be because of repeated strain, can be because of some underlying causes. Treatment and management would be something same like the De Quervain disease we already discussed, like splintage by a wrist wrap brand initially, physical therapies, some anti-inflammatory medication, and obviously if it is because of trauma, giving local rest is very, very important. So, and if it is not cured, local steroid injection can be attempted, which is usually gives good results in those cases. But always keep in mind that local steroid injections, it is not the first resort. So good trial of conservative management is always a very good option, especially for the patients who are coming at the initial stage. So after we finish the wrist one, we move to the elbow and some forearm problems, and then we'll finish our discussion. Then we'll have the question answer. So I would request everyone to put up your questions, your queries, because after we finish the elbow, we can going to take up your questions and straight away we'll going to answer you. So again, very common things. Everybody knows about it. Sachin Tendulkar had it. It's a tennis elbow. So elbow commonest problem of pain is a tennis elbow. Everybody in their lifestyle, in their lifespans must have suffered from this disease. I am also suffering from the same disease because in our surgery we need to put a lot of screwdrivers. We use screwdrivers to fix bones. We need to put screws in the bone. So that requires this twisting activity in the hand. Though we have some machines, tools to use that nowadays. But yes, same type of activity, repeated twisting activity can lead to a problem and pain in this area of the elbow. So exactly you can pinpoint your pain here and on the outer side of the elbow it is called a tennis elbow. Whenever you are doing any twisting activity you feel pain here, and sometimes the pain can radiate along these muscles because it's a pain is at the root of the origin of the extensor muscles, which muscles are actually responsible for the extension of the wrist. So this guard is actually the whole extensor muscles which is coming to the wrist. So pain can radiate up to this area. There may be a continuous uneasiness, and whenever you are doing something twisting activities, squeezing your clothes or taking something from your back to front, holding something by rotating or twisting your arm can cause a tremendous pain here. That is called tennis elbow. Common, as we told, in because of the occupational hazards, people who have to do rotational activities commonly, like mechanics, like players, other activity, other professions where that requires a repetitive movements of the hand can lead to a tennis elbow. And yes, the other underlying diseases remain same as before, or because which are true for the all tendinopathies. So that is very important. So that is all from for tennis elbow. Now, if you can understand that why it happens, there is a degeneration in the fiber of the muscles here. It got strained, it got spooled because of the repetitive strain or strain. So there is a degeneration of the fibers here, and body is trying to heal that degeneration, and that causes fibrosis. And that fibrosis and neovascularization actually causes pain. That causes pain. So pain is pinpointed, mostly pinpointed here. So initially we start with conservative therapy. We give them to use a belt, which is a tennis elbow support. But keep in mind that the tennis elbow support belt is actually not worn over the painful area. Rather, it is slightly below the painful area so that it allows the movement of the elbow. It's not exactly over the painful area. It's just slightly below the painful area. And don't tight the belt too much. Make it comfortable. If you make it very tight, then you have feeling some numbness in your hand, and the pain in the distal part of the arm can increase because of the over tightness. So make it comfortable, and any belt brace should be worn whenever there is movement. Please don't wear belt or brace whenever you are resting, unless specifically advised by your doctor. So this should be the dictum. that any belt and brace should be worn whenever you are doing some activity, whenever there is movement of your limb. Please don't wear whenever there is you are taking rest. So for tennis elbow, initially we start with some anti-inflammatory, some painkillers, and we give local heat therapy. Local ultrasound physical therapy can give better results. If you feel radiating pain, then a local IFT or TENS therapy can be of valuable, and we allow them, advise them to use the belt whenever they are working. And for the initial acute phase, we request them to avoid the twisting activity. That is important. Again, next step is investigations. You need to check to do an X-ray that what is the underlying bone is okay or not. You need to do sometimes if there has been an injury, especially in a professional like player or something like that, you can do for an MRI to detect any tear in the muscle or in the elbow joint or in the ligaments. So once you finalize that it is a tennis elbow and there is no other major pathologies underlying, then the treatment becomes easy. It usually heals up with conservative management around 80%. If not, then local steroid injection over the painful area can give up to relief up to in 90% patients. Only 5 to 10% patients may require some surgical intervention. Like nowadays, we are also doing a PRP injection that is called platelet rich plasma therapy injection. That is, we take blood from patient's own body and we separate the components of the blood. We take out only the platelets, we make it as a concentrate, and then we inject in the tennis elbow area, painful area. Why? What is the rationale behind? It's because the platelets in our blood, they contains all the healing factors. That means they can help in healing of the muscles, they can help in healing of the blood vessels. So platelet concentration actually help to heal the muscles in long term. So platelet concentration injections in the painful area or in the damaged area of the muscle can actually help to heal the disease and properly. Especially for some sports person, we like to prefer to treat them with PRP injection rather than a steroid injection. But a steroid is also very important and valuable because it gives you immediate relief. 3 doses of injection can cure the disease, and most of the patients who are suffering from elbow pain for tennis elbow, we are comfortable using steroid injection unless it is contraindicated by underlying diseases like diabetes. So, and finally, surgical options is there. Surgery is a arthroscopic surgery. It's a microsurgery or keyhole surgery. So we do arthroscopy, see within the joint, and from the joint outside, we just see the muscles which are actually damaged. We either burn them or we either debride them. That means we take it out. Only those damaged part of the muscles, so that the painful area is removed, and gradually after that rehab therapy and physiotherapy actually helps to improve the pain for them. So this is tennis elbow, and a similar painful condition in elbow happens is called a golfer's elbow. So now we can understand because of the movements of the play it requires. So in tennis it requires lot of this movement. So these extensor muscles are repetitively used, whereas in golf it is requires lot of flexor movement, or the flexor group of muscles are repeatedly getting used. So that is why in case of golfer's elbow, the pain is inside the same point. In the tennis elbow, it is the elbow outside point, whereas in golfer's elbow, it is the point which is inside our body. If you can feel the bone here, yes, that is the point, because the flexor group of muscles are actually attached here on the medial side, inner side of the elbow, whereas the extensor group of muscles are attached in the outer side of the elbow. So the symptoms are almost like same as tennis elbow, only the location of the pain varies. It's the inside. Again, the repetitive action, flexor action, we need to throw something, we need to play something, we need to do something like this way. Those are the persons who are prone to get this type of the problem. So this is called golfer's elbow. Treatment is identical to tennis elbow, except that in case of golfer's elbow, we actually don't try to put steroid injection not very frequently, because here there is ulnar nerve, or one important nerve is going to this area very near to this painful area. So 99% of these cases actually heal by Conservative mode of management, yes, PRP injection, platelet rich plasma injections are beneficial for golfer's elbow also. And yes, last option uh, is a surgical release by arthroscopic surgery. And there are various exercises, stretching exercises are there, which is important in the phase of rehab, because once if you treat it by steroid or PRP, whatever, you need to strengthen the muscle. So post treatment, rehab or proper stretching exercises are also very important. So these are the all common conditions of painful conditions of hand, wrist, and elbows. I think I have covered all the common problems. There are many other rare problems are there. Some neurological problems are there. Some entrapment neuropathies are there. But again, as I told you that today we are okay. So that is why we have discussed the local issues today, and let us. Okay, so now we are going to answer your questions. I hope I am audible. So I will take your questions one by one. Please. So having cervical spondylosis from last 10 years, what percentage of risk for the cervical will also radiate to lumbar spondylosis also? So yes, one request I'll try to make whenever you are putting any questions, please mention your age and if you having any other comorbidities like diabetes or hypertension, because it will be easier to me to answer all those questions. So yes, any spondylosis, you need to understand that spondylosis is a degenerative disease. As you grow, your hair becomes white, your skin becomes rough, same as your joint cartilage becomes worn and torn, same as the disc in between your spines will become rough, you will progress. So any spondylosis will progress with your age. You need to focus on strengthening your muscles, you need to focus on strengthening your bones. There should not be osteoporosis, there should not be deficiencies of vitamin D and other problems. So, and your lifestyle should be okay to prevent any such issues. So yes, if you are suffering from cervical spondylosis, definitely you can develop lumbar spondylosis also, because it's a age related issues and it will grow with your age. Is there any interventional treatment available that will permanently overcome ankylosing spondylitis? Last year gave us injection therapy that was lasted for 1 year relief. No, basically no, because you need to understand ankylosing spondylitis is a disease which is linked with your gene. Your gene, if you have a HLA-B27 positive gene, which actually have the tendency to stiffen up your spine and your joints. So that tendency will remain with your life, because this disease uses your own immune system to destroy the joints and make it stiff. So we cannot extract that gene. Maybe in near future some gene therapy or something may come. Then only it could be curable 100%. But at present we don't have a cure to this disease. But yes, early detection, continuous management, proper, and this type of newer injections, these anti-monoclonal antibody injections are coming. Yes, the previous generation injections were they used to give some few years of relief, but nowadays, as we go on, we'll see better and better injections will give you long-term relief. But yes, there is not a cure to the disease still at present. I am facing pain in hip bone from last 5 years, currently at age of 45. Mel, is any intervention or treatment that will give permanent relief from pain as still working is going? Yes. So first of all, we need to understand what is the exact cause of your pain, whether it is coming from your spine or it's the hip joints which are responsible. So if it is coming from your spine, we need to do the MRI and see that what is the cause. It is a disc prolapse, it's a osteophyte impinging on the nerve, it's an annular tear, it's a spondylolisthesis. So pinpoint diagnosis is important. So because unless you know what is causing the pain, your treatment will be vague. So we need to do the investigation. Get a proper checkup done from an orthopedic surgeon. He will check your spine, your hip joint, and the cause of your pain has to be treated in that sense. Nowadays, we have very good treatment, interventional treatment of every conditions, like starting from disc prolapse to sciatica to radiating pain. So yes, every problem has got a treatment, but we need to first understand what is the problem. So pinpoint diagnosis is very important. Do menopause has any connection with bone pains? Yes, obviously, 100%. So this is a very common questions, but everybody knows that after postmenopausal women become weak because of the sudden absence of estrogen. Because estrogen has got a direct linkage with calcium metabolism, calcium and vitamin D metabolism. Estrogen is a hormone, vitamin D is also a hormone. So estrogen directly improves the calcium absorption from to our body. It improves the vitamin D absorption to our body, and it settles up the calcium within the bone. So at after menopause, there is sudden absence of estrogen. So the calcium metabolism, vitamin D metabolism got deranged and disturbed. That causes the sudden reduction in the bone density. So yes, postmenopausal woman is an indication of testing your bone density or DEXA scan. So please, postmenopausal, you need to give extra care to strengthen up your bones. Exercise to overcome the pain for long term. Yes, all exercise. Yes, exercise is the best way to remain fit and to treat and improve pains. Because if you have heard my lecture, I have told in all diseases, initial stage we start with some exercise, some stretching, some physical therapy. Unless there you do a lifestyle modification, or unless you practice good healthy habits or do regular exercises, these diseases are not going to give you relief. So exercise, all exercise, you can do yoga, you can do swimming, you can do cycling, all these exercises. But two things I will mention here, that practice should not be there, like yoga, because in all yoga centers they used to put mats and sit in the floor. But persons who are have already having knee issues or already having knee arthritis, please don't sit on floor. So it's better to sit on a couch, a hard couch, and do the exercises. Because sitting on the floor and getting up from the floor is actually not good for your knee. This is important. Second thing, people who are already having back issues or lumbar spondylosis or disc prolapse something, for them any exercise which had to be lean forward in standing position should be avoided. So all the back muscles exercises, all the spinal exercises should be done in lying down position in a hard bed. That is preferable. In a lying down position, you can flex your body, you can take up your knees over your abdomen, you can do all the spinal flexion exercise, extension exercises. Gravity, the effect of gravity is eliminated. But whenever you are standing and bending forward and trying to reach your foot, whenever you are getting up, too much stress is given on the spine. That is not recommended for patients, older patients who have already have osteoporosis, and patients who already suffered from back pain issues like disc prolapse and other things. So do all the exercises. It's the best way to be fit. It's the best way to treat chronic pain, but keep these precautions in mind. I usually face pain in fingers and palm, usually long holding urination. Please guide why this happens frequently. Yes, again, I do not know your age and other problems. If you are suffering this type of issues, if you have pain in hand, fingers, and palm, I already told this could be a carpal tunnel syndrome. And if you are female, then obviously that is a very common issues. So please do check with that. And difficulty in holding urination can happen at old ages, and also it can be a symptom of a herniated disc or disc prolapse in lumbar spine. So if you are also suffering from a low back pain which radiates to your leg, and also you are finding difficulty in holding urination, do check with one MRI to see if there is any disc prolapse which is actually compromising the function of the control of the urinary bladder sphincter. And also you can get the NCB test done, which can say that whether you are suffering from any carpal tunnel issues or not. My granny is having moderate kidney diseases. These days she complains about pain in thigh muscles. Why such things she is facing? So all the older age group patients, the most of the time the cause of any pain, maybe it in the bone or maybe it in the muscle, is because of osteoporosis, osteopenia and sarcopenia. So osteoporosis is a brittle bones, osteopenia is the calcium is less compared to normal bones, sarcopenia is the muscles are weak. So these muscles also require some energy, vitamin D, vitamin B12. If there is a deficiency of serum calcium, vitamin B12 and vitamin D, there that manifestation would be bone pain, joint pain and muscle pain. And because of deficiencies of other vitamins like vitamin E, there might be muscle cramps, especially in the nights, nocturnal cramps in the cup muscles, thigh muscles. So in old age patients, please do and check for osteoporosis. And if there is an underlying diseases like a kidney problem, diabetes, hypertension, something is there, ischemic heart disease, then definitely she is high risk factor for osteoporosis. So to detect osteoporosis, please do a DEXA scan. DEXA scan will show you how much strong is the bone, how much brittle it has become, what is the risk of fracture. Then do check for all the calcium and vitamin D, vitamin B12 deficiency. Give her calcium supplementation, good calcium salt and adequate amount of vitamin D supplementation and vitamin B12 supplementation. These things will cure or help and improve the muscle pain in her. What are the risk factors for carpal tunnel syndrome? Yes, I have told you the persons which actually use their hand too much, or in the person who they work in a flexed wrist like this. So if you suppose somebody is actually doing this wrist like this for suppose 4 to 6 hours for 24 hours. So in those cases, it's very difficult. The nerve gets blocked here and there must be a pain. So the occupational hazards, it can cause because of occupational hazards. Next, it can cause because of underlying diseases like hypothyroidism is a very common association in female for carpal tunnel syndrome. Rheumatoid arthritis is a very common association. Traumatic, if there has been a fracture in the distal radius or wrist which has been operated or which has been treated by plaster, can cause carpal tunnel syndrome. So these are all the risk factors for carpal tunnel syndrome. Sometimes it may be of idiopathic. That means in those patients we don't find any diseases, underlying diseases, just it happens. Last year during pregnancy phase had painless injection. Since then facing consistent pain. How to overcome this low back pain? Yes. So there is a misbelief in the society that the injection which has been given for spinal anesthesia can cause back pain, especially in pregnant women. So trust me, this injection pain, the needle is so small, this injection pain maximum can last up to 3 months, not more than that. But what is neglected in pregnant ladies is that before pregnancy, they took the advice of the doctor very seriously for the child. That regular calcium, regular iron, regular vitamin D, they take it every day. But once the child is delivered, they start neglecting themselves. One pregnancy, the amount of iron lost from our body, the body took about 3 years to get back the sources back. So taking the iron, calcium and vitamin D post pregnancy is also very, very important. If you don't take that regularly, if you stop that, you will suffer from back pain. And all of them actually relates this back pain to the injection. But trust me, it's not the issue. So proper, when your body is recovering, proper supplementation should be there. And especially if your child is having breastfed, then lactating mother's demand is even more higher. If somebody, a normal human being, the daily requirement of vitamin D is 1000 international unit, a lactating mother should be supplemented with 1600 international unit per day. So proper calcium, vitamin D supplementation in adequate doses is very important. If you are deficient in that, definitely will suffer from knee pain, you'll suffer from back pain, you'll suffer from lethargy. And again, if your baby is having milk from you, then the baby will also get deficiency. So please don't neglect post-pregnancy supplementation, dietary supplementation, adequate calcium vitamin supplementation is also of immense importance. And spinal anesthesia or injection in the spine, that pain can last only up to 3 months, not more than that. What diet to follow and any ailment application you will suggest for toddlers bone strengthening? Yeah, diet is very, very important, not only for toddlers, for pregnant, for everyone. Balanced diet should be there. The adequate supply of calcium, vitamin D3 has to be there. And the demand of calcium and vitamin D3 is more in case of growing age group, especially in toddlers. So the previous belief was something like that, that only calcium is needed when a lady grows up above 60. It's not like that. So there is a term called peak bone mass. That means our body is bringing and making the bone strong. So our body can do that up to the age of 30 years. It's like that you are doing a job and earning money. So you can earn the money up to age of 60 years. After that, you have to depend on that money. You can buy something and use that money, but you can't earn more. So same thing like that. Body reaches a peak bone mass, it's around 30 to 35 years. So up to 30 to 35 years, if you don't give that child or the growing toddler a good amount or proper amount of calcium and vitamin D, then the bone deficiency will remain for long term. Right? So that is important. So all these toddlers should be given a balanced diet. There should be enough amount of leafy vegetables, enough amount of fruits, whatever seasonal fruits are there, either milk or curd, a lot of fibers in diet, and the balance of protein. So balanced diet is very, very important. Deficiency should not be there. In spite of that, calcium and vitamin D supplementation should be given in growing age group so that the peak bone mass they reach, it should be at a higher level. That peak bone mass will prevent osteoporosis development at a later age. So the foundation should start from the very beginning. Next is, what is the tentative cost of surgery of tennis elbow pain? If at all required, arthroscopic debridement is can be done, and it is around, maybe depends on 65,000, something like that. Please share some details on hip replacement. At few days back, one of my family member had injury to fall in bathroom. Yeah, hip replacement indicated in some conditions where we replace the cup of the hip joint and also the head of the femur. So those two components are there like that. So maybe it is properly, it should be done properly. There are a lot of types of um, uh, joints are there, that is important. So hip replacement, it can be done from neck of the femur fracture, where both the cup and the head both are replaced, and they gives articulation. A properly done hip replacement give very good results, and but few things cannot be done after a hip replacement is that you cannot sit in the floor, you cannot squat like that. Okay, so these two things are restricted. Rest all, it's a very good operation. If done or properly indicated, it gives good results. I am 55, male, diabetic. This is just frequent if it's tingling just in my palms. Yes. Okay. For diabetes, tingling and numbness sensation in the palms and the soles and feeling of sweaty feeling is could be a development of diabetic neuropathy, because diabetic neuropathy is a very common complications. It could be of carpal tunnel syndrome also, but diabetic neuropathy usually more commonly starts from the lower limb or under the feet, and it actually progresses, comes towards the body. And also it starts from the palm. The feelings are same, that you will feel numbness, dizziness, you'll feel sweating of the hands. The hands will feel like clumsy. Suppose you are holding a very small thing, you will not get the feel of that. So please exclude diabetic neuropathy. Your control of diabetes should be proper. Second thing, that your need to check the nerve conduction velocity of all four limbs, because initially whenever there is a diabetic neuropathy, the symptoms are not there, but when the symptoms are there, already the disease has progressed up to 30%, and medicine will give very good results along with physical therapy. So do check for that and control the diabetes properly. This is very important. My uncle few months back faced paralysis attack. These days he is complaining about elbow pain. Please suggest corrective steps. He is hypertensive also. Right. So for post paralytic patients or the patients who have suffered stroke, suppose there is a, usually the common features is the involvement of one side of the body. So what is important in the rehab phase of this paralysis patient is that you need to understand that some part of the brain is damaged. Some portion of the brain which controls that area has been damaged. So there has been destruction of the strength around 50 to 60%. So by that time the brain recovers, you need to do the physical therapy. That means the patient is not able to flex the joints or move the joints actively. So you need to continue the passive movement, because passive movement will make the nerves and muscles strong. Passive movement will prevent the stiffness. That is very important. In some of the strokes, if some of the strokes, the activity and the attitude of the body is like fixed, it is called rigidity. So the patient tries to always do the hand flex, finger flex. So what happens in those conditions, the muscles get contracted. Suppose if somebody is keeping this elbow for long term, the muscles get contracted and there is ossification within the muscle. So calcium deposition starts in these muscles. The body senses that these areas are actually dead, these areas are not functioning. So in this post paralytic patients, what is of immense importance is physiotherapy, regular physiotherapy. It may be required for many years, maybe 1 year, 2 year, 3 years, then only the strength be regained. So physical therapy, regular physical therapy, prevention of any contracture is of utmost important. And obviously if you feel pain and there is something which can be palpated, tender area, getting an x-ray to be done, because we have seen many such patients who have come with a flexed contracted joint, and in x-ray it has seen that joint has become fused because of the injury in the brain. Some injury in the brain can release some hormones which actually enhances the calcification, and that can cause locking in the joints or fusion in the joints. Okay, so finally, I think this could be the last questions. Shoulder lock disease. It's I think you are talking about the frozen shoulder. So frozen shoulder, what happens that the shoulder, the movements has become locked or fused because of the tightness of the tissues. So all the tissues are getting tight, so your movements are not very easy. And again, the underlying diseases like diabetes and other traumatic diseases are there. Mainly the treatment is to start with physiotherapy, and if it is not cured, local steroid injection can be tried. But early detection, early intervention is of very, very important. So I think we have covered all the questions and are able to answer you all. And briefly we discussed all the problems. So I thank you. I am Dr. Arnav Kormukar. I do practice in Kolkata. I have my clinic in Bhawanipur. I have my clinic in Alipur. Alipur, I sit in Gopalnagar in RX Doctor's Chambers. Exide Mode at Harlem Point, which is just next to the Haldiram in Ravindra Sadan. I also attached with Kothari Hospital, Joint and Bone Care Hospital, Salt Lake, AMRI Hospital, Dakuria, and Narayana Memorial Hospital, Pehala. So we do have my chamber in Welkin Diagnostic at Bhawanipur. So my assistant number is 82401 36591. Again, I am repeating 82401 36591. So, any problem, any further questions, you can WhatsApp that, or you can call for clarification, and you can call for appointment. I wish you all very good health, and still the pandemic is on. Please wear your mask and please take it seriously. We are going through and we're fighting a battle. Everybody, if you can give their effort, we can win. So please wear your mask, be safe, avoid crowded places, avoid unnecessary visits or traveling. Thank you. Good night to all. Be safe.